Hi, my name is Angela Smith. I'm doing this procedure for Lukowski's class for Adult Health 1, Term 2. This is the insertion of the NG tube. First thing I'm going to do is check the doctor's orders and see what he's ordered, which in this case he ordered an NG tube for decompression. And you can do for one of three things, which is decompression, which is continuing suction of the stomach, lavage or gavage, which in this case my doctor ordered it for decompression. So I'm going to verify in the chart his allergies, past history, medications, things like that, make sure all of it's comparable, which it is. And so I'm going to go in and introduce myself to my patient, and I'm going into Mr. Smith's room. Hi, Mr. Smith. My name is Angela. I'm your nurse for today. Your doctor has ordered a NG tube, which is a tube that goes from the nose down to the stomach, and it will be connected to continuous low suction, so we can figure out why you're nauseated and what's going on with you. Can you verify your name and your date of birth for me, please?
James Smith, January 1st, 1975.
Good. I'm going to ask you your history, and have you had any complications with your nose, like any nasal surgeries, any sinus surgeries, deviated septums, anything of that nature?
No, ma'am.
Okay. I'm going to occlude one nose and take a good sniff. Good. And the other one? Okay, good. They seem patent. So now at this point, I'm going to go ahead and take the NG tube and I'm going to measure. And I'm going to measure and expose you for just a moment, so make sure you provide privacy for your patient. And I'm going to apply this towel across your chest, from the tip of the nose, around the ear, to the xiphoid process, just about here, and into the upper left quadrant into the stomach, and that would be about 65 centimeters, so I'm going to go ahead and mark it. It's just a temporary thing. Okay, so 65, and I'm going to place this back down. I'm going to apply my alcohol and hand hygiene. I'm going to put my gloves on. Sorry, my nose itched. Okay, I'm going to go ahead and lubricate my tubing. I'm going to lubricate the first 4 inches. So we're going to go ahead and lubricate. And okay, so at this point, we're going to go ahead and start the procedure. I'm going to have you bring your chin to your chest, and the curled part will go into the nose, flat. Okay, and chin is still to the chest. And if you get, okay, I'm going to hold right there. Open your mouth for me. And I see the tubing is not coiled. Mr. Smith, how are you doing? I'm just going to slowly advance it. So at this point, hold this cup for me, and I need you to take a sip. And with every sip, I'm going to advance the catheter. If at any point he starts to gag, I would pull out just a little bit. Let the patient rest for a second. Verify and make sure that it's not coiling in the back of the throat. And Mr. Smith, are you ready to go again?
Yes, ma'am.
Okay. So we're going to continue, and we're going to go all the way to my marking here, which is 65 centimeters, which is not going in anymore. So we're going to pretend that it's still going. So with every swallow, we're going to advance, 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 advance. Okay. So it gets all the way down to where it needs to be. Open up one more time for me. Tell me your name, please.
James Smith.
Okay, so we're going to ask the patient to speak. And it seems okay. So I'm going to apply my temporary tape to the side of his face, okay, while I do my testing. And I'm going to aspirate stomach contents, hopefully, which I do see stomach contents. Okay, so I'm going to reinsert that back in. And I'm going to grab my stethoscope, and I'm going to put some air into his stomach to listen for bubbling, the upper left-hand quadrant. Okay. Did you hear it?
Yes.
Okay. So I heard some bubbling. All right. So we will. I'm going to aspirate a little bit more because I want to do some pH testing on my Lippmann paper. And he's tolerating the procedure well still. Okay, so I'm going to go ahead and we already had the patient talk. We did the Littman paper. I'm going to go ahead and order a chest x-ray or an x-ray to make sure that the tube's in the correct place. And it came back, and it is. So I'm going to go ahead and apply my permanent tape. Okay. A little bit harder with all this stuff in the way. Okay, so I have my permanent tape on now. Okay. Alright, I'm going to use my rubber band, and I'm going to connect the tube to his gown enough where if the patient moves his head, he won't catch it on anything. Alright. Okay, and now I'm going to connect it to the suction. Okay. And then I would come back to my desk and I would document the time that I inserted the tube, the length, which was 65 centimeters, that I taped it down, the size and the type of tubing that I used, the color of the drainage that came out of the tube, which was stomach content color. I would describe that. I would also describe the Littman paper, whatever the pH value would be. And then I would also document the client's response, the intake and the output for the patient, and then the instructions that I gave the patient, which he tolerated everything well. He clearly understands everything and verbalized it. So at that point, the patient hits the call bell button, says he feels nauseated again. So at this point, I need to irrigate. So I'm going to come back in, reintroduce myself, Mr. Smith. Hey, this is Angela. What did you need me for? And he tells me he's getting nauseated, so I need to verify. Can you tell me your name and your date of birth again?
James Smith.
Okay, which is correct. So the first thing I'm going to do is verify placement. So I'm going to take him off of the suction, and I'm going to irrigate with actually 30 mLs. I need this. So I'm going to draw up 30 mLs, okay, and I'm going to irrigate it, okay. Alright, now I'm going to pull it back, so I'm going to aspirate, and I'm going to see stomach contents, okay, and now I'm going to listen for air bubbles. Okay, so I heard bubbles. So now what I'm going to do is draw up my 30 mLs. Flush 30 again, and then I'm going to aspirate all of that. And if there's a difference, let's say like I go to 45, that's 15 ml difference, so I'm going to make sure that I document that. So pull out everything that I possibly can. You can discard this, but just make sure that you document it. And I'm going to reconnect him to low suction again, give him instruction once again, do the same documentation, the difference of the mLs that I withdrew, the color that I had seen, how I verified placement, and let the patient know, patient instructions. If he gets nauseated again, give me a call. And that's it. Thanks for letting me take care of you.
You're welcome.